.org/PH YouTube, and we will be starting shortly. Thank you.
Muy buenas tardes para nuestras Muy buenas tardes. Estoy aquí diciendo cómo pueden entrar al módulo de interpretación. Van a ver en la parte de abajo de su pantalla un globito. Si seleccionan español, van a poder escuchar esto con toda perfección. Si están en su teléfono, van a ir a los 3 puntos suspensivos, van a buscar interpretación y escogen español. Muchas gracias y espero que disfruten.
Thank you everyone for joining the community update today. We will be starting right at 3:35. You can also watch this webinar live or recorded for later viewing on our YouTube channel, which is at boco.org/PH for Public Health YouTube. We'll be right with you. Thank you everyone for joining us for our community update on COVID-19 in Boulder County. We will be starting right at 3:35. You can also watch this live or recorded for later on our YouTube channel at boco.org/PH YouTube.
Good afternoon, everyone. Good afternoon, everyone. Thank you for joining us here today. We're glad to have you. So as usual, we will have Jeff Zayak, our Executive Director, talk to us about how the data is looking. And he's also going to give us a bit of an update on the proposed changes to the state COVID dial. And then we will get an update from Chris Campbell, our emergency manager, on how we're progressing with vaccines. And to start us off, as usual, I will pass it back to Mike. Thanks, everyone.
Thank you, Chana. We will be doing a Q&A at the end of our session today. To do that, you'll see at the bottom of your screen, it says Q&A. If you click on that, you can type in your question and we will read that out for you. If you're on the phone, we can also take questions. What you need to do is dial *9. That will raise your hand and we'll call on you and you can ask your own question. If you're muted, you can use *6 to unmute yourself. We ask that everyone please keep their questions short and succinct so that we can get to as many questions as possible. Now I'm going to turn things over to Jeff Zayak, Executive Director of Boulder County Public Health.
Hi, everyone. Jeff Zayak here. It's really happy to see you all again. Happy that folks are continuing to join us on these Wednesday calls. I'm going to go through the data. We have good news on the data, and it's a thanks again to all of our community members who are continuing to take these prevention strategies seriously, and we are looking good. I'll share my screen here. And I'll start to walk us through this. So as noted, our data is looking really good. This is the 3 dial indicators that I've been presenting on each week. As you can see, our incidence rate, which is the highest of the 3 indicators, continues to come down. When I reported last week, I believe it was between 280 or 290, but it is continuing to come down each week. We are seeing our positivity rate remain low, which is great, and we are seeing declines in our hospitalizations. This is our 5-day average number of new cases in Boulder County, and as you can see, we're on a steady decline. As noted last week, this just represents that little bit of a bump that occurred between Christmas and New Year's holidays. We were happy to see that that was short-lived and that bump continued downward. This is our positivity, and the good news here is that our positivity has remained below 5% since right about here on the 16th of December, and it's continued to stay low. That means we have adequate levels of testing occurring in our community, and I'll talk a little bit more about that at the end. Our COVID hospitalizations continue to decline. Today on February 3rd, we're at 19. At our peak, we were up here well above 100. And at the previous peak, back in the early part in the spring, we were at 68 as a high. So we're down below where we were in the earlier peak, and we're continuing to head down, which is all good news. I want to talk a little bit about this prediction that's in front of us here. This is from the Colorado School of Public Health, and they have been working with the state health department to look at what might happen with vaccines and the B117 variant in Colorado, which we know the B117 variant is here. So I want to talk a bit about these predictions. In addition, this graph was updated over a week ago now. It's going to get updated again this week, and it will also include some predictions on total case numbers at the state level, which also actually look really good as we're moving forward here. What I want to point your attention to is this dark blue right here where it says, I know it's kind of hard to read this, but vaccine and B117 variant. These are different scenarios that are listed, and each of these lines, these colored lines, are associated with these different scenarios. Because we are in the scenario of having vaccine and having the B117 variant present, I'm just going to focus on this one for simplicity, and because this is the most likely scenario that we're going to remain in. Over here, you can see that there's 3 different projections. One is 78% transmission control, and again, the fancy word for transmission control used to be social distancing. But it's called transmission control now. So this is the current trajectory that we're in. We're probably a little bit higher than this now because this was, again, over a week old. Our numbers have continued to decrease. We're probably closer to 80 or a little above 80%. But this is the latest scenario. And this is relative, these 3 scenarios and this line right here is related to ICU capacity. So this dotted line is the ICU capacity at the state level. In the second scenario, it's at 70% transmission control. And in the third scenario, it's at 60% transmission control. And what I want to highlight here is that excuse me, with vaccines out and B117 present. And some of the assumptions that we're making in the model are listed down here. So that 70% of our population age 70 plus will be vaccinated by mid-March. I'm happy to report that in Boulder County, that will likely happen by the end of this week. And that this variant increases from approximately 1% of the cases when this model was predicted to 50% of the cases in early March. The state health department, nor do the Colorado School of Public Health believe that we will get this high, but they're using it at more as a worst case scenario. And when we look at that, we can see that if we maintain the existing transmission control that we have right now, we hardly have a blip in our numbers in terms of increased trajectory in ICU. When we move to 70%, this bumps up a little bit. So I'm focusing again on this blue line where we have B117 plus vaccine, because this is the current scenario that we currently have in Colorado. You can see that we do bump up a little bit. And at 60%, we're bumping up into this range right here, which is not exceeding ICU capacity, but it's getting closer to ICU capacity. And when I talk to you about the transmission control changes that are likely to occur here, when we looked at the dial changes that I'm going to talk about in a second that the governor's proposing, and we talked with the Colorado School of Public Health last night, they do not see a scenario that is going to take us down into 60% with any of the changes being proposed. So we would likely be between these scenarios here. Again, they'll be publishing more of this data this week when they do their updated modeling. So I'll take us to the changes that have been proposed. Get rid of that. The main changes with the dial that the governor has requested feedback on is a shift from a 7-day incidence rate, or I'm sorry, a shift from a 14-day incidence rate, which is what I've been reporting on each week, to back to a 7-day incidence rate. What that effectively does for us in Boulder County is it brings down our numbers about half of what they are. So if we are predicting, our numbers are at 200, and I can't remember what they were, but let's say that we were at 300 per 100 for a 2-week incidence rate. At a 7-day incidence rate, that's roughly half of that. So that takes our numbers of 300 in a 2-week and puts it at 150, which means that it will more quickly move us down the dial. And the reason that the governor's office is proposing this is because there's more vaccine getting out into our community. There's significant social, economic, and behavioral impacts and challenges that are occurring across the state. I know many of us are certainly feeling this and aware of it. We have some counties that are over 50% on public supports. We've got businesses and counties on economic brink, and we're not seeing as many cases as we were earlier. So the proposals are to move some of our levels back down by creating a 7-day incidence rate. It also is making it more responsive to what's happening in the community. And I want to give you a specific example of that. So when we went from yellow to orange, what we did was we submitted, as soon as we started to hit the orange level, we had to get in touch with the state. We had to meet with the state, talk about what we were going to do in terms of a mitigation plan. We had 2 weeks to put the mitigation plan together. We submit the mitigation plan to the state, and then we have another 2 weeks to assess if the mitigation plan is working, which essentially gives us a month of time to see if our mitigation plan, when we're shifting levels, is making a difference in our case numbers or not. What's happening in this scenario, because this has been shifted to a 7-day incidence rate, is that there is a movement much quicker. So once a county enters into a new level, there is no longer a mitigation process of moving forward, waiting a month, and then seeing. That county will be moved in a much more responsive way to the next level. And that goes for both up and down. And that the only place where that is not clearly articulated is moving from orange to red. And I'll talk about that in a second when I talk about the feedback we provided to the state on this. The second thing is the hospital indicator, excuse me, moving from orange to red, has some new language around it. Instead of just looking at hospital capacity and stable and declining numbers, they added the indicator of staff shortages exceeding capacity and transfer requests. And if we look back to late November, early December, we did have a hospital in the state, Pueblo, that was in this scenario where they had exceeded their capacity and they were needing to request transfers from Pueblo to other hospitals to help deal with the capacity issue. So those are the new pieces that are in the red part of the dial that's being proposed by the governor. And then the last thing is the percent positivity in each category, except for red and purple, which has no limit, have decreased slightly from 10 to 7.5% as an example in the yellow level. And then what we've provided feedback on is we feel comfortable with a 7-day incidence shift as long as the vaccination rates, and this is the reason that the state has approached this way, because more vaccines are getting into our community. Once we have 70% of our 70 plus population vaccinated with the first dose, then we are starting to reduce our transmission of the disease risk in that population. And of course, it takes 2 doses to get fully vaccinated and to be fully protected. And it's not until after 2 weeks that people have received that vaccine that they're fully protected. But getting the vaccine out to these populations is lowering the risk for these high-risk populations. And that is a main driver of why the governor's office has requested these changes. The other thing that we've asked for is that the governor's office moves people up and down in these ranges immediately, and that includes red. That was not clear in the proposal that was put forth. So we've asked that in all of the categories, all the way through purple, that the governor's office will make the decision quickly to move counties to the appropriate level, which would strengthen the framework that we have in place right now. We also have asked for clarification on the hospitalization. When the language was added for staffing in the red level, we want to make sure we understand clearly how that's being assessed. As an example, we heard from our hospitals as we were going through our November surge that they were challenged with staffing, being able to get enough staff to staff ICU beds. It wasn't that the ICU bed wasn't available or the medical surge bed wasn't available. It was that they didn't have enough staff to be able to fully staff those things. So we're asking for clarification on how that assessment is going to occur, as well as the metrics that are going to be used to assess stable and declining cases in blue, yellow, and orange. And the last thing is we need to be careful and make sure we're paying attention to what kind of impacts these proposed changes will have on school operations. As you all know, there's been a strong focus to get all of our kids back in school full-time. With our decreasing numbers, we certainly feel more comfortable moving in those directions. But the impact on how schools operate, as we potentially will generate more cases in our community, even though those cases will not likely end up in hospitalizations and will certainly reduce deaths because we are taking care of our highest risk and most vulnerable population. We will still and do anticipate that we will see some increased cases from these shifts that we're looking at right here. So we want to make sure that we're taking a close look at the school operations and how these changes are impacting our priority populations, which are already impacted. We can clearly see the impacts in our populations of color that are getting less vaccine than our non-color populations, and to make sure that we have access to the same services for all populations across our community and not further exacerbate where we're already seeing some of these challenges for our priority populations that are impacted. And then the last slide I have here is just that we need to keep up the good work. So we're talking about in these last slides, making things a little more open than they have been. And the governor's office, just to be clear, they've proposed this change because of the vaccines beginning to get out in the community, because we're beginning to vaccinate more and more of our high-risk populations. You've probably heard them talk about a phase 3 and a phase 4 change as well. So as more vaccines get out in the community, as we start to incorporate more of the populations being vaccinated, the governor's office has said they will come forward and relook at the dial restrictions based on how much vaccine has been out there and based on the projections that you saw from the Colorado School of Public Health and CDPHE, looking at what do we think will happen with these changes based on what we know about the variant and based on what we know about how this disease spreads. So we can expect a couple more changes in the months to come in front of us. But the message here is, even as things open up, until we have everybody in the community vaccinated to the maximum extent possible, we are still going to see cases increase. So it's still important to, as things open up more, as the 5-star program goes into place, that we still take these prevention strategies listed here, because they are going to help control the spread regardless of where we are and until the time that we have widespread vaccine out in our community. So wearing masks absolutely makes a difference. I've showed you in the past the predictions on how many lives are saved and how much masks can reduce the number of cases that we see. And it's going to be important to continue to mask even after you're vaccinated. It's important to continue to mask until we have, again, the larger population vaccinated to a greater extent. Washing hands is obviously critically important. So as we're out in places where we could be more exposed to vaccines, making sure we're taking note of our personal hygiene is going to be really important. And last thing is to make sure that we're keeping our distance still. So we've worked so hard for so long to get this far, and to continue to just make sure we're maintaining that 6 feet until we have everybody vaccinated will be really important as we move forward. And the last thing that I've showed you before is just, again, if you go to addyourphone.com, you can add that app and it will let you know and send you instructions if you've been close to somebody who has been exposed, and will give you instructions on how to follow up on that. And then last, as you know, our vaccines are getting distributed. We're still doing our best to make sure that we're communicating effectively once we have information, and that's been some of the biggest challenges, is to get timely information so that we can get it out to all of you. And with that, I will turn it over to Chris Campbell, who's our emergency management and preparedness coordinator, and the lead for our vaccine here in Boulder County, to talk more about where we are with that. Chris.
Okay, thanks so much, Jeff. And hello, everyone. My name is Chris Campbell, again, the emergency manager with Boulder County Public Health. I will be doing an update for you on our vaccine administration in Boulder County. Give me just a moment, I'll ensure I get my presentation up. Always so good to be able to share with you in this forum, and thank you to all our community members for joining today. And I will share here. Okay. I'm just going to go through an update for you all, and we can certainly be happy to answer questions afterwards. So today, again, just some situational awareness on where we're at generally with our vaccine campaign. We're making good progress with our 70+ community members, and we want to share that information. Additionally, share information on the vaccine allocation that's coming to Boulder County. As many of you know, we also have a new phased distribution plan that the governor's office released. And I really am happy to discuss with the community and share with you additional vaccine strategies we're implementing, both planning and implementing currently. And these are really focused on health equity in our community, knowing some disparities that exist, and really knowing that the existing vaccine strategies don't always work for some community members. So we want to make sure we're removing barriers for all community members that would like to access vaccine. So we currently have an incredible network of providers in the county, about 32. Just to remind community members, we have significant capacity here, and our providers have been incredible. So this includes all the hospitals in our community, federally qualified health centers, which are clinics in our community, Clinica and Salud, pharmacy partners like King Soopers and Safeway, additional partners like University of Colorado and other outpatient outpatient clinics. With that group, we have the capacity to vaccinate between 20 and 22,000 community members should we see that much vaccine come into the community. Unfortunately, we are not seeing that much vaccine come into the community currently. So we know that we're ready to go if and when that amount of vaccine comes into the community. And I just want to again thank our partners, the providers that have really done incredible work to get us where we are today. I did mention that our vaccine allocation really does vary weekly. So I'll give you a good example so the community understands what we're dealing with. Last week, countywide, our allocation of vaccine was 800 doses. This week, our allocation was 7,000 doses. So it's been a little bit inconsistent, and it's been a bit of a challenge to plan with that. What we do so the community knows is we meet almost on a daily basis with this group of providers. We discuss the vaccine allocation. We discuss if there's gap areas where community members are not being served. And there's commitments amongst that group to address that and really work with the community. So that is the current landscape in terms of allocation. We have vaccinated with that first dose, and I'm happy to share these numbers are steady and going up. And they seem small now, but we are making progress. So about 21,500 community members have received that first dose of COVID vaccine. And the good number we're starting to see is about 7,000 community members with a full course. And that is very important, as Jeff mentioned, because that is when we start to have folks see that immunity really be with that additional level or layer of protection that we're seeking with the vaccine. So progress there. So almost 30,000 community members have received a course of vaccine. With our 70 plus community members, again, we know that is part of the phasing of and the statewide distribution plan. Thanks to our providers, who made very good progress here, and we vaccinated about 52% of our community members that are 70 plus. So this is about 16,000 in Boulder County. We do know there's about 30,000 community members, so we're about halfway there, but still have about 15,000 remaining there to vaccinate. So we can't lose sight of that. We know that we're certainly adding additional community members that now have vaccine available to them, but we can't lose sight of folks, and we will not lose sight of folks that still are eligible for vaccine. We'll talk, this does frame our discussion a little bit, but we continue to track and look at the vaccine allocation and any disparities that are going on. And I think what we can know from this slide certainly is our Latinx community members, certainly, particularly in the 70 plus community members, there could be some barriers there for them accessing vaccine. I'm going to talk about some of the areas we're looking at and really quickly implementing to work through those barriers. So many of you might have heard last Friday, there was an additional update by the governor's office to our vaccine distribution plan, the state distribution plan. And just to be transparent and clear with community members that are on a call today, these decisions are made by the governor's office. We as a provider and as a public health agency then have to follow these guidelines. And so we are. We do scramble a bit sometimes when we get last minute updates to this plan, but know that we're working incredibly hard to clarify things for you and be very transparent and bring the information to you as we get it. So in that phase 1A, we're very close to being done with that. I know there are some community members that still fall in that high risk healthcare category. We continue to encourage you, if you're struggling to access vaccine, to contact us with Boulder County Public Health or to contact other providers. We know there's some one-offs out there still that need to be vaccinated, and you are still eligible. So we are working to get you vaccinated. That 1B1 group, which additionally includes 70 plus community members, but also moderate risk healthcare workers and other first responders. We're moving through that group as well. As I mentioned, we're about halfway through the 70 plus group, and I know we have about a group of about 2,500 community members that fall in that moderate risk healthcare worker group, and we're working very diligently next 3 weeks to vaccinate that group before we then move on to the new phase 1B2. So this includes community members that are 65 to 69 years old, and additionally education providers, so childcare providers, along with our school districts, private schools in the community. So we are now focused on that as well and providing options for those community members. I'll talk about those in just a moment. You'll also see some additional phases that were added in 1B3, for example. These, and I know there are some questions from the community on this I saw in the chat, and we can answer those. Frontline essential workers, that's a big group of community members. We're still seeking guidance on some of these areas and haven't seen it, to be honest, but we know they're there, and again, creating as much infrastructure and access as possible for community members. So likewise with community members that might have comorbidities or high-risk conditions, we know that's there as well, and we are working through those, what that means for our community members and how they can also access vaccine. So some of the numbers I did mention, so when we do add the 65 plus community members, that's an additional 18,000 Boulder County community members that are 65 plus. So that's on top of the 30,000 community members and residents. So just transparency in the amount of community members, they're large numbers, and we're up for the task. We're going to keep working with you all and listening to you all to get you access to vaccine. Just for any of the education or early childhood community members that might be joining, we're excited, and we have worked very hard to work with both the providers. So these are the hospitals in the community and the pharmacies. They have made commitments to partner directly with the school districts, with the private schools in the community, with all the early childhood educators. And we know there's about 750 providers in the county and doing incredible work. So we're excited that plan's in place. What I would encourage you to do is, if you're at one of the school districts, if you're with your early childhood, if you're an early childhood educator, please work with your agency or with your school district or with the private school you're with, and contact them for information. Again, you should already have seen information. Again, we're excited that they are partnered with a provider and will be giving access to you all. This group, just so you all know, is about 10,000 community members. So just again, let you know what those numbers look like. Okay. And I do want to talk a little bit about, and I mentioned this, we know, again, that the system that we have built might not work for all community members, and we recognize that. So we want to talk with the community about this. We continue to have conversations with community members about this, but I want to talk about some strategies, some equity strategies that we're already implementing and are planning for. So let me jump into that. So we know there's systemic challenges that might create barriers for community members. Historical injustice by the medical community, for example, undocumented status might create a fear of the medical establishment. Limited English proficiency, we know there's transportation gaps and concerns. Access to technology, we know, is a challenge for community members. And so these, these traditional strategies we're using currently, a lot of information is on our website and that'd be challenging for community members to access. We recognize that. So our focus really is planning and implementing things that we know will work for community members. So again, this is racial and ethnic minorities, our Latinx community members, people of color, Native Americans, others. We also know we're certainly focused and want to work to remove barriers for those that have been impacted by socioeconomic status, sexual orientation and gender identity, disabled community members. We know there's gaps in access for vaccine for community members in the peak-to-peak area. Similar to how we provided testing in that area with mobile testing, we're looking at strategies for mobile vaccination clinics in the peak-to-peak area. So we really believe that, we want this planning work to be informed and driven by community members, and that has been our focus as we've planned this. So we are collaborating with cultural brokers in the community connectors, community-based organizations, and listening and hearing what the gaps are, what the barriers are for community members, and creating strategies around that. And we really believe in collaboration, this being community driven, it's inclusive on how we're going to approach this, and we all own this as a community. So our goals, again, are really fostering trust. We know that folks could potentially be hesitant to get this vaccine. And so we want to address that and provide information in a clear way and in a proper way that so folks can make good decisions and understand, that why getting a vaccine is right for them. Additionally, there's a lot of logistical challenges with bringing vaccine to community members. And so we are collectively working through those logistical challenges with all our community partners. One strategy we're looking at is what we're calling community vaccination clinics. These, again, are focused on our priority populations, racial and ethnic minorities and other marginalized individuals. What we're looking at doing is these are sites identified by community members. Folks are comfortable going to these sites. They could be faith-based locations in the community, other locations like that folks feel comfortable going to access vaccine. We would do larger clinics with this approach, so maybe 500 doses for community members. We'd partner with hospitals or Boulder County Public Health would provide these clinics. So it's a strategy that we have seen and are implementing. We know that, for example, a partnership between UC Health and Salud Family Health has already worked on this approach and had piloted this in Aurora. And we're real close to identifying sites and actually starting to do these in our community in the next several weeks. Another approach we're implementing and looking at is these are smaller clinics called mobile vaccine clinics. These are for homebound community members that really struggle with transportation or unable to leave their homes, independent living sites, individuals who are unhoused, and groups, again, with mobility or trust concerns. So smaller clinics, anywhere from, it could be as small as 25 to 50 to 100. We are going to go out to locations, again, sites identified by community partners. For example, we do testing regularly at the Netherland Community Center. That could definitely be a site where we go and vaccinate community members. We've done testing in near neighborhoods in Longmont and folks are really comfortable with coming to those sites. So that's another strategy we're looking at. So yeah, I just want to say and thank the community. I know, again, this has been a challenging endeavor. The system's not perfect, but I do believe that together we can do this. So I think I'll stop my update there. And if there's questions from the community, we'd be happy to answer those.
Okay, thank you, Chris. We are now going to open up for Q&As. We'll take as many questions as time permits. Our presenters are approaching these topics from a place of respect. We just ask that you do the same. To ask a question, you will see at the bottom of your Zoom screen, there's a Q&A thing. Click on that, type in your question, and we will read that out for you. If you've called in on a phone, if you hit *9, that will raise your hand. We will call on you and you can read your own question. If you're muted, you can hit *6 to unmute yourself. We ask that everyone please keep your questions short and succinct so we can get to as many as possible. If we don't get to your question today, you can send an email to healthinfo@bouldercounty.org. That's where we answer those kind of questions, so please do that. And lastly, besides our presenters, we have two more people who will be answering questions today. Dr. Chris Urbina, who's the Boulder County Public Health Medical Officer, and Trina Rilland, who is with the Boulder County Attorney's Office. So let's get to the questions. Dr. Urbina, I'm going to start this one with you. What do we know about new cases? Are they because people are not masking, distancing, and washing hands, or is there another reason that things are spreading even if they are taking these measures?
Thank you, Mike, for the question, and thank you, listener, for that question. It's really all of the above. There isn't one specific location at this point that we're saying, or behavior. The virus is looking for people that are susceptible. That is, so somebody doesn't have protection, particularly wearing a mask above your nose or mouth, or having physical distancing, or in large group settings, or as Jeff alluded to, washing your hands and disinfecting. The virus is looking for those susceptible hosts. So if everybody's doing those prevention strategies, that's good. But apparently not everybody's doing those prevention strategies. And so what we always see in the spike of viruses is that you see this big explosion of virus, lots of people infected, they recover, the virus is subdued for a period of time, people relax, and then they don't do those prevention strategies, and we see another peak, as we did see after Christmas, as we did see after those other holidays. So it's not one specific activity. I think gradually opening up with those prevention strategies in place, and as Jeff alluded to earlier, increasing the vaccine to those vulnerable populations will overall reduce our viral spread in the community. Ultimately, that's our goal.
Thank you, Dr. Urbina. Chris Campbell, here's one for you. It's about our phase 1B2. When will people 65 to 69 be able to sign up for an appointment for the vaccine? I know that's probably very provider dependent, but can you talk about that a little for us?
I can, thank you. And I appreciate the message. So that phase opens up around February 8th, according to the vaccine distribution plan from the state. What I would suggest the community do now is go to our vaccine page, which is boco.org/COVID vaccine. That has all our providers there currently. And what our providers have told us is to please, please go there and at the very least sign up for an account. What we do recommend is if you already have an existing provider, an existing relationship with Salud Family Health, for example, or Boulder Community Health, to please go to their site. What you can do is at least create the portal to start to get information. And as the phase opens up to those community members again around February 8th, then you should be able to start signing up. It doesn't guarantee you're going to get an appointment right away, but it will just start the process, get you connected with a provider, and it will allow you, when appointments become available, you will be notified. What I would say to the community is diligently watch those portals in your email for notifications from our providers. What happens oftentimes is, those messages, appointments become available and they fill very quickly. That's how things are working currently. So again, I connect with the provider, go to our website, start to get information. I will also mention that you are able to call our call center if you have questions, if you're unable to access the internet currently, and we should be able to help you with information, connect you with a provider. You're also able to call providers directly. It's not their preference right now, but again, if you do have concerns or are unable to find that information on our website, give us a call. We can provide that number. I don't have that offhand for our call center, or call the provider directly.
Thank you, Chris. All right, this next question is for Trina. It's about our newly expired public health order on spectators in sports. It says, can you explain why Boulder County Public Health is not allowing any spectators at high school sporting events? Other counties with worse statistics have been letting 4 people in per player.
Thanks for that. So as you mentioned, Mike, the order has actually expired as of Monday by its own terms, because we have had 14 days of stable or decreasing cases while in level orange. However, there is a state order still in effect that can put limits on high school spectators, and there may be some venues that cannot have spectators just based on their size and the spacing requirements required by the state order. If you have more specific questions about it, you're welcome to call the call line, but the bottom line is that order has actually expired because of our good data.
Thank you, Trina. All right, Chris Campbell, another question for you. What type of documentation or proof is needed for frontline essential workers in manufacturing when you get to that phase? But I think it applies to any other phases. What kind of documentation do you need to have with you to prove that you're eligible?
Thank you. Another great question for community. We're actually seeking some clarity on this. I would say that our whole goal as Boulder County Public Health is to remove those barriers. Some of our providers are just asking some initial questions, and basically asking you to say, hey, I am one of these, I fit this age category, or I do fall in to this category. I will say that we're also starting to connect with specifically with businesses in the community. So for example, if you work at a grocery store and the grocery store happens to have a pharmacy, likely you'll be vaccinated through that pharmacy, through your employer. We understand that folks, might, try to jump in line or not follow the guidelines. Again, our whole goal is to vaccinate as many community members as possible. We have good trust that, folks understand and will wait their turn. And when that does become available, we're going to share additional information. Likely you're not going to have to show any kind of ID or anything like that. It might be a letter from your employer. We have done that with some of the school districts, and that has worked pretty well. But we're working out some of those details.
Okay, thank you, Chris. This one is for Jeff. It's around school questions. We have a number of that are fairly similar. This one says the CDC released information today that schools can safely reopen without vaccinating all teachers. When will you instruct Boulder Valley School District to reopen? They're only going to follow your guidelines. Jeff.
Mike, thanks for the question, and thanks for the question from the public. First of all, we work really closely with both school districts. What we wouldn't do is instruct them to do something that wasn't going to work for them. Nor do we have the authority to do that. We have been working with the school district closely. We support having as many of our kids back in school as possible. And we talked closely with the school districts when our numbers changed. Our school districts felt like the approach that they were taking now, and to wait until their teachers were vaccinated was the most prudent approach moving forward. And Dr. Urbina, myself, and Jason Volling, who's the Broomfield Public Health Director, are supportive of our school districts in that approach. They talk specifically about wanting to be able to maintain some of the spacing with their cohorts and having a in-person hybrid, obviously full in school for our youngest kids, and some remote based on what people's desires were, was the best approach for them moving forward. And I just want to pause and see if Dr. Urbina, who is very much part of that meeting, has anything else to add.
No, Jeff, I think you covered it well. I do think the schools are making a reasonable decision based on the numbers, that they are watching the numbers very closely as we are, and they've implemented a lot of strategies to prevent the spread of infection within their school systems. And that includes filters, that includes masking, that includes all the distancing that you talked about, Jeff. So I think people, as we can continue to reduce the amount of infection in our community, and as we increase the amount of vaccination, particularly of our teachers and vulnerable populations, hopefully we can make we can help the schools make decisions about further opening up. But I think at this point, it makes very good sense to do what they're doing.
Thank you both. All right, Chris Campbell, another question for you. There have been reports around the country of vaccine doses being left over and wasted at the end of the day because there's no one to sign up for their appointments. I mean, people haven't shown up for appointments they've signed up for. Can you talk about what's being done here in Boulder County to make sure we aren't wasting any doses?
Yes, thank you. And, I can be very clear on this. A couple things. Our providers are very, very good at vaccine management, and we've learned more and more about this. So there's a couple things with this. Very few appointments are missed, and we know that. Most people show up their appointments. Additionally, they're very good at anticipating, because they're using an appointment system, how much vaccine they're going to have and how much they're going to have left over. I know also their providers have backup lists with folks that fall within the categories that are willing to be available at a moment's notice with a phone call, and they can show up in 30 or 45 minutes. It does vary by provider. I am very confident we are not wasting vaccine in Boulder County. I think that's a little overblown in the country. I got to be honest. There might be some one-offs that does happen. We have been very clear, and that's why we have such a good relationship with our providers in the county, to not waste vaccine, period. In fact, I know that they're so connected that if they're not finding community members to vaccinate, they'll call another provider with a list and see if they can get some folks there. So I'm very confident that's not happening in Boulder County, and we're effectively using vaccine.
Thank you, Chris. Good news there. Dr. Urbina, I have one for you here. Are people contagious if they are experiencing COVID symptoms 24 hours after their second dose of the vaccine?
Thank you for the question. I just wanted to be very clear that the vaccine is not 100% effective in preventing infections. That's critical to understand, because we're still recommending that people wear masks, physical distancing, and all the things that Jeff has tried to, and I have tried to reinforce. So although the quarantine guidelines in terms of do apply likely for people that are low risk 2 weeks after they've had the second dose, it is still possible that you can get that infection. So what we're recommending is people still continue to wear their mask and do all those things that we're talking about until we can actually decrease the amount of circulating virus in our community. And so I think this is really a team effort. If we're doing all of those things so we can get those vulnerable populations vaccinated, then I think we're going to have a greater likelihood that we're going to reduce the susceptible people to infection. But yes, it is possible to have the infection, although the disease from severe symptoms as well as moderate symptoms are are a result of getting the vaccine, it is still possible to have the infection, although not likely. And what's interesting about this, just for the reader's sake, is not all the vaccines that were studied have proven that it prevents the infection. Moderna has. Now the new one, Johnson & Johnson, has showed some prevention of infections, but not all of them tested to show that they actually have fully prevented the infection. So this is still a work in progress. We're going to learn more about the clinical trials as we follow these people over an extended period of time that have gotten the vaccine. And as people have known, variants are out there, and we're still looking at the variants to make sure that they are protective. The vaccines are protective against the variants, although it looks like right now the Moderna and Pfizer are still protective, 95 and 94% effective for the common strain of this virus. But the newer variants, it's less effective, but still very effective in preventing moderate and severe infections.
Thank you, Dr. Urbina. We are just about out of time. I've got one question I'll try to get here. And I think it's a speculation we may not know the answer on, but some of the bigger groups that are coming up, the 16 to 69 with some underlying health risk, et cetera, those are really big groups. Do we expect that we'll see any changes from the state to kind of differentiate those out so we can stage people better? That might be for Jeff, I'm not sure, but what do we think is coming with some of these larger groups that are not yet here?
I'm actually going to turn that over to Chris Campbell and see if he knows the answer to that.
Yeah, thank you. Another good question. You know, I had to be transparent with the community. I think there's some work to be done here. We still, as a public health agency, don't have really clear kind of guidance on what these groups are. So, for example, when you mentioned frontline essential workers in manufacturing, that's a very large group. We haven't seen details on exactly what that group is. What I will say is we will definitely have a focus and an equity lens when we look at this and ensure access for community members. It is a very big group. I think hopefully anticipating additional vaccine supply, although that might not happen. So it's going to be a similar message for all of those groups is patience. Just because, again, March comes around when I think some of those are some of the dates that the governor set for that group. You might not have access to vaccine right away. Do know that our number one goal is to vaccinate as many community members as possible and work with you to get you vaccinated. So it really is going to be more information to come. I think it will be clarified, I would say, in the next 3 weeks. We should have more information to share in this community forum.
Thank you, Chris. I'm going to do one more quick one with Dr. Urbina, and then we'll wrap things up. It's a two-part question, but what I'm going to ask you is if I've got multiple health issues, am I at a high risk for reactions when I get the vaccine?
The answer is no. The only risk that you have, if you've had a severe reaction to a previous vaccine, that's called anaphylaxis, and those will be discussed with you when you get your turn to get your vaccine. But for other autoimmune or asthma, you are no greater risk of having a complication from the vaccine.
Thank you, Dr. Urbina. We're going to wrap things up here with some final words from Jeff. We didn't get to everybody's questions. Just let me say, if you've got something you want to ask, send it to healthinfo@bouldercounty.org, and we will get you an answer. Jeff, can you wrap us up today?
Yes, thank you. I just want to say to community members, thank you so much for continuing to join us and continuing to ask the great questions that you're asking. As I've noted previously, we'll continue to share information with you as soon as we have it, especially around the vaccine, which I know has been a really important component for all of you. I do want to share one closing comment. It is very likely that the governor will make changes in the next week or so regarding some of the pieces that he's requested feedback on. And I wanted to just emphasize a couple key points that are very positive for Colorado. In Colorado, we are at about 75% masking. And if you've seen the national news coverage, the rest of the nation is around 50%. And part of the reason why Colorado has done so well during the Christmas and New Year's period as compared to other states is because we have a lot of people taking the prevention strategies. So if we can boost our masking even higher as we open things up a little bit more, it can continue to allow our, again, social, economic, health and well-being to continue to improve at the same time that we prevent this disease from spreading. So please continue to follow those prevention strategies as we are likely to open more things up and do it in a slow and phased way, and we can be successful together here in Colorado. I want to thank you all for joining us, and I hope to see you all next Wednesday. Have a good day.